think as physicians, we're very quick to set ourselves aside and try and not take any praise or glory, but I would hope that this Doctor's Day, that we would be able to just pause and listen as people tell us thank you.
Everything went great.
I think the most rewarding part most people don't know is that I was a patient here for many years. I had a pretty gruesome injury at the age of 17, and it didn't heal right for a few years, and someone recommended for me to come to the University of Tennessee Medical Center for a second opinion. Dr. Scott Smith is my orthopedic surgeon, and he was able to basically save my leg. It was to the point where it almost was going to be amputated, and the ability for him to save my leg, save my life, and now I get to be able to provide the same opportunities to other people is just simply amazing.
I just want to say thank you, that it's a wonderful place to work, and I think each person that brings their attitude every day when we walk in the door makes a huge difference, and it is so nice to look around and see such brilliant, engaged, supportive team members every day.
Deep breath.
I would like to extend an incredible thank you to the individuals with whom I have the opportunity and privilege to interact with on a daily basis. You all contribute in an incredible way to the training of tomorrow's physicians, the care of our patients, and supporting one another and me on our journey on a daily basis.
The hospitalists, the infectious disease doctors, the trauma surgeons, you name it. We're working in concert with them all the time, and I'm very appreciative of the relationships we have with them.
To all my fellow colleagues, physicians, mid-levels, nurses, everyone who is showing up every single day, just know that we see you. You're doing an excellent job. Continue doing great work, and everyone will notice.
I'd like to give a shout out to Dr. Stevens and Dr. Jeter for being amazing female role models.
I want to give a shout out to our resident physicians, not just the 16 in my department, but the hospital-wide. This place absolutely would not run without you, and you make us all better physicians because you're here.
I've seen all the hard work so many people have put in, all the challenges COVID has brought. I tell you, doctors are a resilient and flexible group of folks, and really rose to the challenge over the last few years.
The biggest thing I like here is that everybody worked together with passion to give the best care to the patient.
We could not be doing what we do if it weren't for all of you.
One of the things that I find most rewarding is being able to give back to all of the people that have made it possible for me to be sitting right here today. So taking care of this community is very important to me.
Thank you, and happy Doctor's Day.
My son had cancer, and understanding that there are conversations I remember with physicians that I will never forget the rest of my life. And I'll say this sometimes to residents or fellows, that for you, this next conversation that we're about to have with this patient or family, you probably won't remember next week, maybe not later today, I don't know in some cases, but this family will remember your words the rest of their life.
It's kind of incredible when you see somebody come in with, be it the worst day of their life from a horrible traumatic event to something unexpected as a bowel perforation, incarcerated hernia, appendicitis, things that we see on a daily basis for us, which has life-altering consequences for the patient. To see them through that acute illness, and then also to be able to see them on the recovery side of things, learn about their family, get to know them, and really see that full circle of what it is to take care of somebody.